Today in this module of 4C course, we are going to discuss airway management, and the objectives for this talk are: what are the indications of tracheal intubation in the intensive care unit, how airway management in ICU patients is different from those in the operating rooms, what are the complications of intubation in the intensive care unit, how to assess the airway before you try and intubate a patient in the intensive care unit, what are the drugs and equipment that are required, and what are the checklists that we should tick before we undertake intubation. If you face difficulty, how will you go about planning your algorithm about plan A, plan B and plan C, because you must have these plans ready before you undertake an intubation in the intensive care unit. So, in algorithm in particular, we are going to talk about supraglottic devices and what is the last resort if the supraglottic devices do not work. There is something called as intubation bundle, which was described in 2010, and so we will discuss about that, and there was one study which showed that it probably works, and that is something we should adapt in our intensive care units, and then summarize the talk. Okay, the indications for endotracheal intubation in intensive care unit, the most common indication is facilitation of invasive mechanical ventilation. So, this might be because of inadequate oxygenation or ventilation, because of COPD, etc. It might be required only because the patient is in shock and you want to take away the work of breathing, might be because of cardiac arrest. If it is a neuro trauma patient, you might want to give controlled hyperventilation to these patients, and post operatively sometimes you might electively want to ventilate the patient because the patient has undergone a supramajor surgery and you want the patient to stabilize before you extubate the patient. Another common indication is protection of the airway from aspiration, particularly in patients with low GCS. You might want to intubate patients for tracheobronchial toilet, or you might want to intubate a patient because the patient is in stridor. So, for example, you take this case where it is a 60-year-old 80 kilogram diabetic male with a left lobar pneumonia, and he shifted to the intensive care unit with history of progressive breathlessness and altered mental status for 6 hours. He is drowsy but arousable.